Welcome to the Senior Techie Podcast. You know that feeling when your mom takes a fall?
Or like
Oh,
maybe your dad starts forgetting his daily pills.
right, exactly. And
Right.
suddenly, almost overnight, you are desperately trying to juggle doctors and insurance forms and
And maybe a sibling who lives 3 states away and somehow just won't answer their
Mm.
texts.
Yes, oh, it's the worst. And if you are, nodding your head right now, or if you've been dreading that exact scenario, we want you to know you are not alone.
Yeah, you're really not.
Because that is the exact moment most families discover that they actually needed help about 6 months ago.
It is an incredibly universal experience,
Mm.
but it feels so isolating when you were the one standing right in the middle of it.
Oh, absolutely.
I mean, the sheer volume of information you were expected to process during a medical or cognitive crisis, it's staggering. You go from being a son or a daughter to a full-time medical coordinator,
Yeah.
literally with zero training.
Which is just an incredibly unfair position to be in. So we want you to know right off the bat that if you're feeling lost or overwhelmed by this whole process, your feelings are completely valid.
Yeah.
We hear it all the time from readers of the Senior Techie. You aren't failing. The system is it's that complex.
It really is.
But we are here to help you navigate this landscape without feeling left behind or, frustrated. So our mission for this conversation is to introduce you to an incredible kind of little-known profession that's built entirely around solving this specific elder care chaos.
And plus, we're going to share a very empowering, very practical tech tip to help you prevent a major family headache down the line.
Exactly.
And the relief this information can provide to a stressed family is just truly immeasurable. But before we get into who these professionals are or what they actually do, we kind of need to clear the air.
Yeah, let's do that.
Because elder care is full of technical jargon and, well, systemic complexities that are designed for institutions,
Right.
not families.
Right.
So let's redefine some of these concepts right now using some real-world analogies, just so we're all operating from the same baseline.
Let's unpack the vocabulary because nothing makes you feel more out of your depth than an acronym you just don't understand.
Exactly.
The first one that always trips people up is Medicare and Medicaid navigation.
Okay, yeah. So let's look at it this way. Imagine you were trying to find your way through a massive, constantly changing international airport.
Oh, wow. Okay.
Yeah, and you have no map. The signs are in a language you only partially understand, and this is the kicker. Every single terminal has completely different rules for boarding.
That sounds like an absolute nightmare.
Right, but navigating Medicare and Medicaid is exactly like wandering that airport with your luggage. It is a sprawling bureaucracy, and one wrong turn, like filling out the wrong form at the wrong time, can mean a denied claim or, a massive delay in care.
So you're just standing there at Terminal C wondering why the gate changed without an announcement and nobody is around to give you directions?
Yep.
That paints a very clear picture. So what about this next one? Hospital discharge planners. Because you hear this term constantly if a parent ends up in the ER.
Right, so think of hospital discharge planners as air traffic controllers.
Okay.
They are sitting up in the tower looking at a radar screen full of moving parts. And their primary job is to land a plane, which, in this analogy, is the patient safely at its next destination.
And that destination could be home or it could be a rehab facility.
Exactly. And they have to coordinate this landing without crashing into obstacles.
Yes.
Right, things like insurance limits or a lack of available facility beds.
And just like real air traffic controllers, their priority is clearing the airspace.
Yes.
They need to land the plane and move on to the next one, which honestly explains that intense sense of urgency families feel when dealing with them.
Oh, 100%. It feels rushed because it is.
Okay, our last piece of jargon is a tech term, Apple Legacy Contact, or just, password management in general.
Okay, so think about your physical home. You probably leave a highly secure spare house key under the mat, or maybe with a very trusted neighbor.
Yeah, just in case you get locked out or there's an emergency.
Right, so setting up an Apple Legacy Contact is literally like leaving that secure spare key, but for your digital life.
Oh, I like that.
It just ensures that someone you deeply trust can get into the house, meaning your digital accounts, your photos, your critical information, when you physically cannot open the door yourself.
The spare digital key, I mean, that makes a rather abstract tech concept feel very tangible.
It does.
So keeping that constantly changing airport of elder care in mind, who actually serves as the guide through all of this, because we mentioned there is an entire profession built around solving this chaos.
Yes, there is. They are called aging life care professionals.
Okay.
And look, if you haven't heard of them, do not feel bad. This profession actually used to go by the title geriatric care managers, which honestly probably made a little more intuitive sense to the average person.
It kind of does. But professions love a rebrand.
They really do.
It sounds a bit more polished. But what is their actual function? Like, what do they do?
Well, they are certified by the Age and Life Care Association, and you can really think of them as the ultimate project managers for someone's aging years.
Project managers. Oh,
And these are not amateurs. They typically come to this work with deep clinical and professional backgrounds in nursing or social work, gerontology, maybe psychology.
wait. If they are bringing that level of clinical expertise, I imagine their day-to-day involves a lot more than just handing out brochures.
Oh, way more.
So what does a project manager for aging actually do when a family brings them in?
So their core responsibility is to assess a situation, build a comprehensive care plan, and then crucially, keep that plan running when the family members are exhausted or geographically scattered.
Okay, so let's break down the mechanics of that.
Sure. So first, they conduct incredibly thorough assessments. They are the ones who can objectively determine if it is still safe for a parent to stay in their own home.
By what, just asking questions?
No, not just asking questions. They are looking in the refrigerator for expired food, they're checking the rugs for tripping hazards, and looking at the pill bottles to see if medications are actually being taken.
Oh, wow. So they are looking for the blind spots the family might be missing.
Yeah,
Or perhaps willfully ignoring because, acknowledging them is painful.
precisely. And next, they do the heavy lifting of coordinating. They act as the central hub between doctors, specialists, and those air traffic controller, hospital discharge planners we talked about.
Right.
They make sure everyone is actually communicating so, a cardiologist isn't prescribing something that conflicts with the neurologist's plan.
Which happens more than people think. I would also assume they get heavily involved when a family needs to bring in outside help, because vetting in-home caregivers feels like an absolute minefield if you don't know the industry.
Oh, it is. But they know exactly what red flags to look for. They know the reputable agencies in town, they know the turnover rates, and they take all the guesswork out of bringing a stranger into a loved one's home.
That's huge.
But honestly, their most valuable service might actually be mediation.
Mediating family disagreements.
Yes.
I mean, I can see how that happens. You have one sibling who lives down the street and sees the daily decline, while the sibling out of state visits twice a year and thinks mom is doing just fine.
That is the classic dynamic. So when siblings are arguing over what's best, an aging life care professional steps in as an objective, experienced third party.
That makes sense.
They de-escalate the emotion and refocus the conversation on the practical reality of the care that's actually needed. And finally, they monitor the care on an ongoing basis to catch small problems early, before they spiral into a full-blown crisis requiring an ER visit.
I have to push back here, though.
Okay, go ahead.
This sounds incredibly helpful from the perspective of the adult child trying to manage things. But isn't it really hard for older adults to accept a stranger coming in and evaluating their independence?
Absolutely.
Because I know if someone came into my house to look in my fridge and evaluate my ability to live alone, I would bristle at the idea. I feel like my autonomy was under attack.
It is a completely natural reaction. I mean, nobody wants to feel like they are losing their independence or being managed.
Right.
And the professionals anticipate this. The initial reaction from older adults is often quite resistant. It feels like an admission that they can no longer handle their own lives. So we really have to validate that vulnerability.
So how do they get past that wall? Because if the senior won't cooperate, the whole project management plan falls apart.
Well, the reviews from families, and that includes the older adults themselves, usually flip very quickly once the work actually begins.
Really? Why is that?
The mechanism behind that shift is the hands-on approach.
Yeah.
You aren't going to some sterile clinic to be judged by a doctor in a white coat.
Yeah.
They come to the client.
Oh, I see.
They are doing these assessments, sitting right in your living room, having a cup of coffee.
Well, that makes a massive difference. They are meeting the client on their own turf, which preserves a lot of dignity.
It really does. They are visiting the rehab facilities during the discharge process to literally look the air traffic controllers in the eye. They tour and evaluate assisted living and memory care communities on your behalf.
Wow.
And they host those family meetings, sometimes managing a video call with scattered siblings across 4 different time zones. And keep in mind, most of them operate as small, private practices.
So it's very personal.
Very personal. You are hiring a dedicated, specific person, not just getting handed off to a faceless corporate system.
That continuity must be a huge relief for the medical system, too. I mean, if the discharge planner just needs to land the plane, having a designated person on the ground to receive the patient must make their job significantly easier.
Oh, doctors and hospital social workers increasingly view these professionals as essential partners.
I bet.
The medical system knows it cannot manage the day-to-day realities of a patient's home life. And frankly, families usually lack the clinical expertise to manage complex medical needs. The aging life care professional bridges that massive structural gap.
Okay, but we have to talk about the elephant in the room here.
Let's do it.
If these professionals are doing all this specialized hands-on work, how does a family actually afford them?
Right. We need to address the fee-for-service model very clearly. These professionals generally charge an hourly rate.
Okay, and what does that look like?
Depending on the region you live in, you can expect that rate to be anywhere from, say, $100 to $250 an hour. And the hard reality is that Medicare typically does not cover this cost.
Wait, paying $100 to $250 an hour out of pocket, that is a very steep barrier.
Yes, it is.
If Medicare doesn't cover this, isn't that an impossible luxury for a lot of families who are already stretched thin by medical bills?
It is a very real barrier. I won't sugarcoat it.
Yeah.
For some families, that out-of-pocket cost is simply not feasible, and it really reflects a larger flaw in how we fund elder care in this country.
Yeah.
But for those who can find a way to budget for it, the framework kind of needs to shift from seeing it as a luxury to seeing it as a strategic investment in disaster prevention.
Okay, break down the math on that disaster prevention. Where is the return on that hourly investment?
The return is in untangling the structural problems that would cost thousands of dollars to fix after the fact.
For instance.
Well, think about the financial mechanics of moving a parent into an assisted living facility. Families often just pick the closest, nicest looking one. But if it's the wrong clinical fit for the parent's specific cognitive decline, they might literally get kicked out 3 months later.
Oh, wow.
And you lose the massive move-in fee, and then you have to pay to move them again.
Or I imagine they could suffer a medical crisis because the facility wasn't equipped to monitor their specific condition, which just leads to another hospital stay.
Exactly. Or consider the legal and financial mess of bungling a Medicaid application.
Right.
If you make a simple mistake on the paperwork, you could delay coverage for months. That means the family has to pay completely out of pocket for a nursing home during that gap.
That's terrifying.
So paying for a few hours of expert guidance up front to sequence those forms correctly, it prevents devastating financial mistakes later on.
It's like hiring a seasoned guide before you trek into the wilderness, rather than paying for an emergency rescue helicopter after you've wandered off a cliff.
That is the exact dynamic at play.
So to truly understand the value of that hourly rate, let's look at a real-world example from the inside. We actually have a great story from a reader of The Senior Techie.
Yeah, Pete Kaplan.
Right. Pete co-founded an aging and care advisory firm in the Chicago area called Silverstead Partners, alongside his partner, Mara Seiler-Price.
Pete's story is just a perfect illustration of why this field is growing so rapidly. Because you see, his background was not in elder care. He actually spent 23 years at Deloitte.
Which means his entire career was built around managing complex systems, analyzing data, and, organizing corporate chaos.
Exactly.
But then he became the power of attorney for both of his aging parents. And I mean, I can infer where this is going. If a Deloitte executive gets overwhelmed by the medical system, the system is fundamentally broken.
Right. All of his corporate project management experience just hit a brick wall when it met the reality of American healthcare.
Wow.
He experienced the chaos firsthand. He was trying to manage scattered financial accounts, decipher this opaque Medicaid planning, coordinate his family, and try to locate a dozen different passwords just to keep his parents' lights on and the bills paid.
I mean, it's overwhelming.
It is. He saw how even the most highly educated, highly prepared families completely fall apart under this pressure.
And that is where his partner Mara comes in with a completely different but really vital perspective. Mara has deep insider expertise. She spent over 2 decades working at the Centers for Medicare and Medicaid Services, or CMS. She was there overseeing Medicaid programs.
Yes, and that is huge. She knows how these massive government programs actually function on the ground, not just how they look on some bureaucratic PDF.
Having a former CMS insider on your side sounds like an absolute superpower. But how does that inside baseball knowledge actually change the outcome for a family? Like, give us an idea of what an insider knows that the rest of us don't.
Well, navigating these programs requires knowing the unwritten rules.
Okay.
For example, Medicaid has a rigorous look-back period for assessing a senior's financial assets. If a family starts transferring money or selling assets in the wrong sequence before applying, the system automatically triggers a penalty period where coverage is simply denied.
Oh, I had no idea.
Right. An insider like Mara knows exactly how to sequence those applications and financial evaluations so they don't get rejected.
That's incredible.
She even knows the specific clinical buzzwords that an insurance adjuster needs to see on a physical therapy extension request to approve it versus the words that will get it instantly denied.
And that relieves an immense, crushing burden from the family. They don't have to learn a whole new language while their parent is lying in a hospital bed.
Exactly.
So together, Pete and Maura act as what Pete calls a continuity partner.
A continuity partner is the missing link. You see, when the hospital discharges a patient, the discharge planner's job is done.
Right.
When the insurance approves a claim, the adjuster's job is done. But the patient's life continues. The aging life care professional is the one looking at the entire continuous timeline of that person's life, connecting all the dots that the individual institutions just ignore.
Let's pivot for a second and connect this to something very tangible you can do right now. Pete mentioned the nightmare of dealing with scattered financial accounts and locked passwords.
Yes.
And while the medical bureaucracy is really tough, the digital lockout is something we can actually solve today.
This is such a critical tech tangent. In this line of work, password chaos and permanently locked accounts come up constantly. It is one of the most common and honestly easily preventable crises families face when a parent has a cognitive decline or the sudden medical emergency.
And the solution is a remarkably simple feature from Apple called Legacy Contact. You can find the full guide on how to set it up at support.apple.com. But let's go back to the analogy we used at the beginning of the show.
Right. This is your digital spare house key left safely under the mat.
Yes. And whether you are the senior setting up your own devices or you're the caregiver helping your parent, setting up a legacy contact is a really practical first step.
Definitely.
It allows you to designate a specific, trusted person who can access your Apple account data in the event of your passing, or if you become incapacitated.
And the mechanism here is important because you aren't just writing your password on a sticky note. Apple generates a secure cryptographic key. If an emergency happens, your trusted contact provides that key in a death certificate or legal documentation to Apple, and they are granted access.
That's amazing.
It stops the family from having to jump through massive legal hoops or even sue tech companies just to retrieve family photos or access banking apps on the phone.
It just stops the panic of, oh my gosh, how do we get into Dad's phone to find his financial contacts before it even starts? And we really want to assure you, you can absolutely do this.
Oh, yeah, it's easy.
It just takes a few minutes in the settings menu of your iPhone or iPad, and it removes a massive technological barrier during an already emotional time.
Taking control is really the theme of this entire discussion. You know, whether it's taking 5 minutes to set up a legacy contact or budgeting to hire a professional care manager, it's about being proactive rather than reactive.
So let's summarize the big takeaway here. When should you actually consider hiring an aging life care professional?
Well, if you are managing care across multiple states or trying to coordinate with siblings who have very different opinions, or, and this is a big one, if you are in the middle of a health crisis that is completely outpacing your ability to research solutions at 2 a.m., seriously consider it.
But on the flip side, if things with your loved ones are simple and stable right now and you have a really good handle on their medical needs and their living situation, you probably don't need to hire one yet.
Right, not yet.
But, and this is a new angle we want to leave you to mull over, don't just think about your parents. What does your own aging plan look like?
Oh, that's a great point.
We spend so much time reacting to our parents' needs that we forget our own children will eventually be in our shoes. Setting up that legacy contact today isn't just about your parents, it's the first step in your own aging project.
So look up the Aging Life Care Association directory now while things are stable.
Yeah.
Because waiting until the ER calls you in the middle of the night, that is how well-thought-out decisions turn into panicked, rushed ones.
Think about what peace of mind looks like for your family right now, before the storm hits. Find the name of a professional in your area, write it down, and just put it on the fridge. Just knowing who the guide is makes the idea of navigating that crazy airport a lot less terrifying. This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to receive their free newsletters, you can subscribe at subscribe.theseniortechie.com.